Hi guys, welcome back to another video. It's me Nikita helping you to come to the UK as an international student or a healthcare professional. Now many of y'all have reached out to me about band 4, that is physiotherapy assistant and occupational therapy assistant roles, and whether these roles offer you sponsorships and are they easy to find within the UK. And today's video is going to be all about answering that question. So if you are interested, please keep watching. So the first thing that I would like to talk about is what is the job responsibility that's associated with these roles. So these roles are for people who will be able to support occupational therapists or physiotherapists during therapy plans or therapy programs, or even in terms of assessing and advising patients to do certain interventions. So these are for more non-complex patients where the diagnosis and the treatment is more directive, and the physiotherapist can now just tell the physiotherapist assistant what is a plan that they would like them to follow. Another thing that these physiotherapist assistants or occupational therapist assistants would be doing is, if the physiotherapist or the occupational therapist has already made a plan, they would just see that the patient is carrying out these exercises or is performing these exercises well. The third responsibility for assistants is obviously making sure that the therapy programs are up to date, that the documentation is up to date. They can possibly even write discharge summaries if they are trained for it. The fourth role that's associated with these assistants is a lot of admin related work. So they are responsible for booking in patients, for scheduling clinics, for coordinating within the team. They are also responsible for maintaining a certain amount of whether equipments are in place or what equipments need to be ordered, or does the team need any more help in logistics. So along with the clinical role, it's also a lot of logistics and admin related work that I think you should be aware about before taking on a role like this. And finally, the fifth and the most important responsibility for PT assistants or occupational therapy assistants is that they get to attend in-service trainings that happen almost monthly or twice in 2 months. And this is a good thing because now you get the opportunity to be trained along with the PTs or the OTs within the team. Now, coming on to what are the basic requirements for this particular kind of job. So, the first and the most important thing that I would like to highlight is that you do not need an HCPC registration. So, if you are from India, Pakistan, Bangladesh, and you do not have an HCPC registration at the moment, you can still apply for these roles. The second thing, obviously, is that some of these roles may require you to have a English language proficiency, but this can obviously be seen on the job description. And if you are confused about where do you find these jobs and what is a job description, I'm just going to leave the link for my videos above where I've explained all of this before. And finally, coming down to the last thing is what is the basic requirement for this job. And most of the jobs in band 4 levels ask you to have your GCSE. So your GCSE is equivalent to your 10th or 12th standard class in India. So for example, 10th or 12th standard pass in India could definitely apply for these jobs in the UK. Now coming down to what does the salary look like and what does the sponsorship for these jobs look like. So the salary for these jobs is about 22 to 25k pounds per year annually, from which obviously taxes will be deducted later. And also in terms of sponsorship, because this is a full-time job, it would provide you with sponsorship. So this is definitely a good thing. It's a added bonus. It's a positive thing for all of us individuals trying to apply from other countries within the UK. But I'm just going to link down some of the positives and some of the negatives that I think are associated with this job and the sponsorship. So coming down to the positives, the first and the most biggest positive that I feel is associated with this job is that you get an entry within the healthcare system in the UK. So you can start working as a healthcare professional within the UK. You obviously get some amount of experience working in an assistant role. So there's no lot of responsibility or a lot of understanding that you should have these responsibilities, and you can just sit and observe how the therapists or how the occupational therapists keep assessing their patients and what does therapy look like within the UK. The third thing is obviously that you get to attend a lot of in-service training, so you're building up your knowledge and skills about how things work within the UK and how you can improve your skills further as a physical therapist or as an occupational therapist. And finally, the fourth thing is you get an entry into the NHS pension scheme. Now, if you are confused about any of this and would like to talk about more with me, I'm just going to leave the link for my website down below where you can contact me directly and we can have a one-to-one chat about this. But coming down to the cons, or coming down to the negatives or things that are slightly difficult related to the sponsorship specifically for this particular role. So, like I've said before, this role, the essential requirement is just that you need to have a GCSE. So, a GCSE, like I've explained before, is just you need to have your 10th or your 12th standard certificate with you. Now, that means that a lot of people with basic level of education within the UK are also eligible to apply for these positions. So even if someone has just completed their high school or their sixth form within the UK, they can now apply for these jobs within the NHS or within the private sector. And if an employer is able to find someone who locally can attend to this particular role, they would not want to hire an international student or an international healthcare professional. Now, this is because, again, when you try to hire an international healthcare professional to come and work within the UK, you have to provide a certificate of sponsorship, and there are many other associated charges that are applied for the NHS trust themselves. And if they can find a person locally, they do not have to pay all of these additional charges. So they would prefer to hire a candidate who is available to them locally. And because the requirement for this job is so basic, just a 10th or a 12th standard degree, it's quite easy for them to find individuals locally as compared to internationally trained healthcare professionals who are just waiting for their HCPC applications. And the second thing is obviously in terms of the visa processing times. So, for example, for these roles, they almost want someone who can start working immediately, say within a month. And we know that sometimes the visa processes and things like that can take about 2 months or even more than that based on our own timelines. So, just based on that, they always want to find someone who can fill up the position immediately. Now, that being said, I do not want to discourage any of y'all who are applying for these jobs and who want to get this job in the UK. I'm just trying to make this video so that all of y'all out there are aware about the challenges and the positives that are associated with this particular role. So that's it, you guys. I really hope that this brought some clarity about Band 4 positions for all of you out there. And if you like this content, please do not forget to hit the thumbs up or the like button. Please share it with all of your friends or colleagues who are planning to come to the UK and work as healthcare professionals. And if you have any questions, doubts, comments, and you would like to connect with me personally, you can find the link for my website below. But also, you can leave your questions in the comment section below and I will get back to them. But that's it, you all. Take care, you guys. Bye bye.